There she is. You did it.
I did do it. That was my
Good job,
challenge for the
Dr. Mary.
day. This is my first Instagram live, so definitely struggling.
We did it. It's
That's all right.
awesome. It's
We're
perfect.
here.
You look amazing.
Thank
Um,
you.
Thank you so much for being here, Dr. Mary.
I appreciate you asking me to be on. I appreciate your help spreading this message.
For sure. I'm going to talk. I want you to talk to me like I'm a layman and someone who's not in your world. And I know that's hard for you because you're in your world so deeply. So I prepared a couple of questions for people who have asked me questions about alternative treatments for specifically this period of time, but also making relevant the topic of alternative treatment, holistic treatment all the time, which I think is incredibly important to bring up right now because especially at a time where we're facing something that is detrimental to unhealthy people and people with pre-existing conditions. It's just like we have to do everything that we can to be as optimized and as healthy as possible all the time.
Right.
So, okay, so first let's talk about what you're doing that's different now in terms of like how you're treating the pandemic in conjunction with what your normal practice has been looking like.
Okay, so our normal practice, we have the two locations, one on St. Charles and one in Metairie that we just opened at the first of the year. And after we do, the Remedy Room is an innovative clinic that offers nutritional therapy, intravenous therapy to bypass a lot of the inflamed GI tracts that a large portion of us are dealing with, right? Where we're not absorbing our nutrients. And so we're having a pretty good impact just because of that. And then with this virus, we've had to separate the two clinics. There was a bit of a restraint in regards to what we were allowed to treat. So doctors and dentists, sort of in order to spare any materials for the hospital in case there was this massive overload, they paused all of us and said, okay, only on emergency basis can you see anyone. So our clinic quickly shifted to really just drastically reducing the number of people that we see at one time so that we could keep everybody separate. And we continue to see our patients who were still getting chemotherapy and going through whatever chronic care conditions they had to support them, because stopping their care would have been detrimental to their health. So we left the Metairie clinic to treat those patients and acute cases that were not COVID related. And then we've kind of transitioned this Uptown clinic to be for people who are positive. So the people who are coming to see us have already been tested or presumed positive. So,
Okay. So after someone gets tested positive, they have an option to either go home if their symptoms are not too bad. And then there are other options that they're generally presented with are what?
so we've seen the gamut of when it comes to integrative or alternative medicines, a lot of times we're not the top of the list, we're sort of the last resort. And so we've seen a range of people who were freshly having symptoms like within the week, and then in the beginning really they were like maybe 10 to 14 days out where they'd had fever for multiple days in a row. They finally went and got tested, and then they just still weren't feeling better, right? Or they've been to the hospital and they got told, you're not sick enough to stay. You can come back if you get more short of breath. So the range was really wide and still is wide, and the range of who is on what. So like some people were on one antibiotic, some people were on the combination of the trial of hydroxychloroquine and azithromycin, some people were on nothing and didn't want to take it or started it late, So we really have seen quite a broad range of people who we're treating for symptoms. So I have to be very cautious just in this day and age. At this point, it's almost like words and semantics can be twisted on you. So I want to just say, I'm not treating anyone from here, and that we don't treat COVID. We are treating the symptoms of what a person who is either diagnosed or presumed with COVID has. And we would treat this same person with the same thing who had any viral illness that presented this way. So this
Mhm.
happened in the name of this one, but we use these therapies and we support the system so that the body can heal itself. Our main goal is to bridge you or to give you what we find are very common nutrients that keep people's immune system from being able to do what it's supposed to do. And so we're really just sort of that extra little bridge until the body can take over.
Right. And me as a non-medical professional, what my gut reaction would be, should I be getting sick, or should anyone that I know get sick, would be, um, I can go the route that everyone in the hospital is going, but I'm not seeing any positive results there.
Well, and they're delaying. So there's multiple factors there, right? So they're in the beginning when people were getting sick, they were almost scared to go to the hospital because they saw that the outcome wasn't really much better or different. And so they're kind of, yeah, you're stuck between a rock and a hard place. Obviously we have seen some great results. I don't have the long-term studies, and neither does anyone when it comes to this specific virus, but we have seen results, and we have continued to see results with the people who we treat for their symptoms for viral illness. So there is something that can be done. It's just, it's not FDA approved, and it never will. I mean, vitamin therapy is not something that they're going to monitor because it's not a prescription drug. So the vitamins are made in pharmacies that are FDA approved and monitored. So there is regulation there, but I don't know that it'll ever be an FDA approved uh, treatment.
Right.
That makes sense. So the best
Of
you
course.
can do is support your immune system, support your symptoms, right? So people were not eating for, a week at a time. So we're supporting them there. They were unable to taste or smell. They are massive fatigue because when you're acutely ill, you get deficient in vitamin C. Your use of it, your need of it goes up because of the
Hmm.
stress. Oh, you know what I think? Is anything I'm doing causing sort of like a echo?
No, sounds
Okay.
great.
And
So,
so
okay.
we're finding that people who are super sick, the majority of the patients that they know that are admitted to the hospital, we're sort of getting that wake up call to these other comorbidities, whether it's obesity, which, over 70% of the population, almost 80% of us are either overweight or obese, whether it's coronary artery disease and whether it's diabetes. It's all inflammation. So it's a clear distraction of the immune system, right? So what we're trying to do is bring that back in and say, okay, look, we know that those guys are deficient in C, deficient in D, and those are the main players for the immune system to do its job.
Hmm. So if you intervene with someone who's progressed in the illness, are you still able to get results using vitamins that you've
We,
seen in your
that
anecdotal experience?
we have seen, and it's been both ways. We have people who, in the beginning, we weren't insisting that they be consistent with the therapy. And so I saw people get well and then they get sick again, well and sick again, right?
Hmm.
We didn't purposefully test it. Either the person couldn't come back the second day in a row or the third day in a row. We've seen great results of people who were really, we've had some patients with brittle diabetes that wasn't controlled, or shortness of breath and very poor saturations, that those all improved after the first day. Fevers that had not gone away with the over-the-counter therapies that the people were using, gone after the first therapy. So the results are pretty awesome, but again, we can't pinpoint what the one thing. We just are
Hmm.
supporting the whole body. And I think because this is a strange virus in that it's causing a lot of very different presentations. I will also say every person hasn't come in with the standard three things you've heard. It hasn't always been cough, dry cough, fever, and loss of sense of smell and taste. It's been, sometimes it's headache, sometimes it's been severe back pain. And so, not to scare people, but it's having some strange presentations.
Right. So you're suggesting, and to me, like these suggestions are non-harmful because there are really no side effects of the therapies that you're using. So, like you telling me, okay, if you're really sick, um, why don't you try to do an IV vitamin C protocol for the next 4 or 5 days? Really, there's no negative to trying that, correct?
Well, the downside is, yeah, that I have to put a needle in your arm, which of course other doctors who are anti what we do would say that that's putting them at risk, but they're also just as much at risk for staying at home, and especially considering schools with telemedicine and these doctors unable to physically touch these patients, right, and listen to their lungs and see where they really were. It made it very difficult for them to make the decision, and so a lot of them got told to stay home. So the decision between staying home and being proactive and trying something, that the biggest takeaway that I want people to know is that these vitamins, there's no toxic upper limit of vitamin C. When they do studies, they've proven time and time again not only the efficacy of this massive antioxidant, but that it's safe, right? Really big doses. So patients who are ill with cancer, who are supporting their immune systems and supporting their healthy cells, take anywhere between 25,000 and 150,000 milligrams in one IV over a few hours. So it's news to people. They've not heard that before, but these big doses do act like a drug in the body. But
Mm-hmm.
because it's made from a vitamin, it is actually this natural substance. They've proven that it's very little to no side effects. So it's, to me, it's like such an thing right in front of us. Like, why aren't we using this natural, non-toxic therapy that's effective, that's been proven with multiple different viral illnesses, not just this one? So it seems that it would work, and in my experience, I've seen it improve people's symptoms greatly.
And the reason why you're describing it in dosages is because, you know, unless you really take responsibility for your own health and you're doing your own research with this, you can be told in a hospital setting that you're getting vitamin C and that it's not necessarily moving the needle for you. However, potentially you're not getting the dosage that is necessary in order to move the needle or with the correct combination, correct?
That's exactly right. And what is a mega dose to a doctor who's been told their whole practice that over 500 milligrams is a high dose, then yes, someone who's getting, what I heard recently was at a hospital recently that they said they're giving 1,000 milligrams every 6 hours. So that's 4 times in a day. They got 4,000 milligrams intravenously. Now, that's going to be helpful, but it's not going to move the needle, and it's not. Um, I don't know what the barrier is. I think it's just a lack of the experience, and and not only lack of knowledge, but almost a resistance that's like lifelong, like many years deep. And so my fear is that we have doctors who say, well, we're using vitamin C, and they're not really using it to the degree that it needs to be. So then they're going to, again, negate it. Say, well, we tried it, it didn't work. Well, the dose for Plaquenil, I think, is, 400 milligrams a day on the day 2 through 5. If we use 25 milligrams, we're probably not going to see the results we're looking for. So that's all of the orthomolecular doctors who study cellular medicine. This is what's happened in the past, and it seems that it could potentially be happening again. And
Mm-hmm.
when we look at the studies that have had success for the patients in China, Sheena, they were using anywhere between 12 and 25 grams per day. And then if the patient was severely ill, they bumped it up to 50 grams. That's 50,000 milligrams or 25,000 milligrams. And so in the US, we've taken it to say, okay, we're just going to be super cautious. And they're using 1 to 1.5 grams compared to 50.
Well,
So
right.
if a person with cancer is that inflamed that they need, or they use anywhere between 25,000 and 100,000 milligrams, it would make sense that we should try at least that much on someone who's a very acutely ill in the ICU. So the
Mm-hmm.
dose that's required is dependent on the fire. That's sort of what I say. Is the dose is dependent on how much inflammation is there.
Right.
Clearly, if they're obese and diabetic and have all these other problems, there's a lot of inflammation to begin with.
Right.
Yeah.
Whew. And
It's a mouthful.
I
Sorry.
can just see and feel that you use so much of your energy to try to educate the medical community because they're not going to get the evidence and the experience that you have in using these nutraceuticals because they haven't done it for the extended period of time that you have, nor have they done it in the way that you've done it because they've been unable to, because their scope of work wouldn't allow this type of treatment. And so, like, I can imagine the frustration that you have in trying to help not only the medical community, but the people who are sick, obviously get well and surpass the need for, the end result, which is like getting on a ventilator, where there aren't a lot of success stories past that point. And that's a frustrating thing. And I find that, I've come across that sort of feeling as well, and sort of the things that I talk about in the world, like, everyone listen, like, please pay attention. I have an announcement to make. I really want, the best for everyone. And
Yes.
I think, like, you know, my message has changed to, you know, everyone who's listening has an opportunity to take responsibility for their health, and actually everyone has the responsibility to take control of their health through education, through seeking information, through really feeling intuitively what feels right. And I was telling you yesterday, Dr. Mary, I think I told you yesterday, but you know, when my dad was going through chemotherapy and was diagnosed with pancreatic cancer and then eventually died of treatments of like cancer treatments, there's a big there's a move to be in a fear state through that experience, and that fear state really causes you to make decisions that are also fearful, and a lot of times that does not give you the results of changing that frequency. You know, like if you can kind of be centered and be in a state of love and hope and faith that whatever position and condition you're in, there are options and there are experiences that might be light bearing, and healing, then that information actually might have an easier time getting to you through podcasts, through videos, through the things that you're researching on the internet, through friends who, you know, feel that your energy is opening up and that you're open to alternative information. And that's kind of where I try to get my audience, is really in a state of taking responsibility and full autonomous nature of their own health, so that if they did have to go to the hospital, they are armed with this knowledge that, hey, the vitamin C you're giving me is not even close to enough. So they're either, you know, arming their loved ones with that, or they're walking out and walking into a place like Remedy Room actually motivated and energized to heal themselves.
Mm-hmm. Well, you've hit the nail on a few heads of people definitely waking up to the need to care for themselves and be proactive, and to recognize that we can't rely on someone else to heal us or make us well, right? And you talked about intuition, and I've said this a few times. It's funny when the panic hit, and you know, it had been going on since January. We might have put a few posts about what was happening in China, because we had one of our doctors he's on the ground, who was instrumental in creating those studies. So when they started treating the virus, we were announcing about it, but it didn't really hit here until I don't know what happened. Maybe, oh, I remember, it was the social media when they started showing those guys falling over and dying in the street. Now, who knows what was really happening, but it really like opened everyone's eyes to, oh, okay, this is serious. But innately, intuitively, people went to nutrition and went to get vitamin C, minerals, like the things
Mm-hmm.
that they almost like they remembered, right? And they didn't need the news, they didn't need to wait for the news. And this isn't just about people going and taking vitamins. There's a large portion of the population that takes vitamins and they don't even tell their doctor, right? So that's
Right.
a problem that we've got to deal with. But we recognize that nutritionally we need these things to make our body work better, right? And that maybe we now finally at home are aware, and it starts with awareness of what am I putting into my body, which is where you come into a big piece of the city of teaching people about nutrition and about, you know, using this fuel, using food for fuel to create energy. And if we don't change our behavior, if we don't change our lifestyle, we don't change not our mindset, but also what we're putting in our mouths, and we don't change our activity levels, like we're going to get stuck in that place where we might need someone else's help, where we need the doctor, and that shouldn't be. We can do so much on our own, and our bodies
Right.
are thing.
Right. And it's just a different experience of healing. Like when you are making a positive change of like eating vibrant foods, and walking into a place like the Remedy Room, like you kind of feel excited because you feel that, in my opinion, it's noticeable what's about to happen. Like, okay, my resonance is about to change. I'm about to feel better. It's just a knowing. And I don't get that same experience a lot of times in walking into a hospital. That being said, is it necessary? Sure. Is am I thankful for emergency medicine? Absolutely. Do I
Yeah,
support the people who have to be in the hospital every single day? 1000%.
yeah,
Um, this information is more so just about educating people to know that there are options available that are moving the needle for very sick people that do not involve going to the hospital and inevitably being isolated from your family and being put on a ventilator. There are options before that point. Um,
Well, and I really want to stress the options of like being aggressive about your care and not waiting like a week or 10 days or 14 days.
mhm,
Um, what we're seeing is obviously this virus, if it does get past the upper airways and into the deeper lungs, that's when it can turn. And so I think there's been a big push in the news for people to buy a pulse ox. And I like people having knowledge. I like them being able to monitor themselves and have almost being their own caretakers, their own doctors. But then what's the next step? So there's a lot of discussion about testing and about, okay, doing a pulse ox, but then what are you going to do? So hopefully, I think your listeners and my listeners know that, arming yourself with things that help the immune system work better, like vitamin C, like vitamin D, that we know that have been proven and have um, whether the study is 200 milligrams or 2,000 milligrams, we know any is better than none, because without those things, the electrons and the energy that you need to create more energy for your body to do its job, you need that, right? And so I think that's why the impact we're having is because skipping the gut, right? These people, again, nutritionally not sound, probably dehydrated because of the fevers and the things like that. So the the best part of our day is having these people come back I'm asking them to come multiple days in a row because this is an aggressive virus that we're seeing, but to have them get better each day and have the symptoms just kind of tick away each one of their symptoms. That's really our goal. And then hopefully what you and I can do here is to say, like, don't let it get to that point. Don't let it get to the point where you need that.
right,
Get your trace minerals, eat your green leafy vegetables. If you've considered drinking green drinks, like, do it now. If you haven't gone out in the sun, like, it's okay. Pull the curtains open and go be outside. Like, get those UV light and get the rays and
right.
exercise your pocket, breathe.
So for
So
some of the advanced listeners who might have been doing all of these things for quite some time, I'm always looking to like take the next step in my own immunity and health and like reduction of inflammation, supporting my detoxification system. Like the stress that we're under is so immense that I almost feel like no matter where you are in terms of your health journey, like if it feels good to kind of like lean into that next step or do that additional thing, why not? So
yeah.
like can you just briefly like NAD and glutathione right now, like
Sure.
including those things in and like maybe how to do that?
Okay. So yeah, your number one job is to take care of you. So you're going to take the best care of you. And if you take good care of you, then the ripple effect of everyone else will be positive, right? Because when you're happy and you're well cared for, all of that ends up working for everyone else. We focus a lot about detox and taking away the things that are harming our bodies, whether it's things on our skin, in the air we breathe, in the water we're drinking. And so with that, over time, when we're born, we have like let's say a white bucket of paint. We're all white. And then as each year passes, we get filled with a little bit more toxin, a little bit more toxin. And that little toxin isn't just chemicals. It can be emotional toxins. I hate myself. I don't like me, right? Or I'm fat, I'm ugly. It can be someone physically abusing you. It can be all of those things. It can be the mental gymnastics that we do on the what if of, especially even right now, not knowing what's going to happen next means we don't have control, which means we're in a panic state. So just accepting and being present, right? But the things that we focus on in terms of physical detox is helping the liver and supporting the liver, because if the liver is clear or has less infringement on it, like glutathione is the number one antioxidant that we make in all of our cells, and then it stays and lives mostly in the liver. Well, it lives there because that's the area it's needed most, because it's there to help clear toxins. Well, you can use glutathione whether it's intravenous, nebulized, where you smoke it like an asthmatic with the smoke. You can use transdermal, and then there's liposomal, which is in a gel form. Those are the best ways to get glutathione. I don't know that there's people who still sell it, who you would just swallow a pill. That everybody knows you're not going to absorb it that way. So those are the top hits. And in the last week, there was a study that showed that there was much improvement with these people who had pneumonia from the virus with inhaled glutathione. So
Mm-hmm.
that's one way to support the liver. N-acetylcysteine is a precursor to glutathione. So that's a good example of how the hospital uses a medicine that's not really a drug, it's not a prescription drug, but it's like a vitamin, it's an amino acid, and it turns into glutathione. And we use that for people who overdose on acetaminophen, and we use it for people who have dye toxicity. So we know that it helps increase glutathione and clear out the liver. So N-acetylcysteine and glutathione are great ways to help support the liver. And then they also, glutathione is an antioxidant, so it recharges or reboots the vitamin C that you take. So now you have more killing power with your white blood cells, right? And more ability to make more antibodies. Because vitamin C has antiviral properties, so specifically to virus, and it also is an antioxidant, so it reduces massive amounts of inflammation. And that's what's going on in the lungs, right? So it's the immune system or this cytokine storm you might be hearing in the news. Your immune system is being flooded. It's like the alarm that says there's inflammation is not being turned off. And so it's over an overreaction. Well, the beauty of these natural things is that they modulate the immune system. So where you need to elevate certain cytokines that would help, it does that. And where you need to decrease the ones that are causing the inflammation, it does that. So that's the beauty of these natural products, that they know how to go up and down based on what you need.
Right. And if not, most of them you'll just pee out.
You'll pee out, or you'll use up, right? So think of it like, if we're talking about in energy terms, you're really donating an electron. You're kind of helping the charge so that you can create more NAD, more ATP. So you talked about NAD. That's something that I think is going to be really helpful for these patients who develop what's called post-viral asthenia. After people get, let's say, mono or one of the severe viruses, they can have fatigue and struggle getting back to their normal for many weeks after. So that's actually my concern. Like, I'm worried about what's going to happen in the next month or two with these people. Yes, they're improved with the IV, but are they winded by the end of the day? Like, do they have a nap? What's going on with their thyroid? And so NAD is a supplement that comes from B vitamins, from actually B3 niacin, and it is instrumental in creating energy for ATP. So I think we may end up seeing some studies with it. That's also a vitamin, but I think it can be hugely impactful people's energy and help them recover from something like this.
Mm. Um, and again, like, just a note for the people who are not necessarily directly affected by the virus, but are just sort of living in this time where we're having to adapt to so many things,
Stress.
like changing our programmed responses to our life is very energy consuming and also very stressful. And so, like, I find a huge difference when I get injections of NAD and glutathione, and it's just
Magnesium.
magnesium, take magnesium at night, B
Yeah.
vitamins. Like, there's just like no downside to really upping the intake of healthy foods, nutraceuticals, and like to educate yourself on, like, sort of, the best thing for me is to just partner with someone like you, so that I can kind of, like, my records are kept, but at the end of the day, it's an investment. And so I'm just going to direct people to your page to learn more about how to get glutathione, NAD, NAC, vitamin C from food, from supplements, from
From
IV
exercise.
therapies.
Yeah,
Yes.
IV. There's all, we have sublingual, there's intra sub-Q, there's IV, there's, the intramuscular, no, the patch, no. I see great results, but there's more available for people to help to load their levels. There are precursors that are out on the market. That's NMN and NR. I don't know what, nicotinamide mononucleotide, or
For NAD,
nicotinamide
for creating. Okay.
so the precursor, like NAC is the precursor to glutathione, NMN and NR are precursors to NAD. And
Okay.
but exercise helps you to increase NAD, right? So hit high intensity interval training. So this is it's not just supplementation. It's also not doing the things that decrease it, like
Right.
smoking, drinking, and a glutathione. I think is probably one of the bigger players. You have a lot of patients who come to see us and say, I used to be able to drink alcohol and now I can't anymore. I think it's a combination of things, of not having enough glutathione to be able to clear some of the things, the aldehydes and um, the tannins and things from the alcohol, as well as the liver being congested with whether it's environmental toxins, PCBs, glyphosate, you name it,
Hmm.
and a very large amount of inflammation that it can be subtle, and it can even just be yeast. Like you think about people who struggle with bloating and GI disturbances. So yeah, it's all connected. The big thing I say is, like, it's not one thing. It's not going to be just vitamin C that's going to make everything better. It's a combination of getting the head and the body. It's connected. It's not like you can just take care of one versus the other. Because
Right.
I'll say, like, if I get to your head here to say you can see yourself well, right? That you can know that you're going to be better, then all is for naught. Because we can get the physical body well, but it won't last.
Mm. So true. So true.
Yeah.
Um, right. You can tell someone what to do when they're really sick, and if they're not aligned with doing it and they don't see that their positive outcome is through that path, they're exactly, it's for naught. So the mindfulness and the meditation, that's something that I talk about a lot, just like clearing the mind, being in nature, like doing what's intuitively coming to you that maybe prior to this time it was really easy to just bypass that thought and to just keep moving and keep going and keep doing everything that you normally do. Right now, it just seems like of the utmost importance to honor um, your emotion, honor your intuition, and to be open to the education and the information that is coming out at this time, which is not only about healing and holistic medicine and alternative medicine and the things that you've been preaching about, but really the world.
Yeah. Well, and the world is finally getting a chance to pause. And I think you said it perfectly, letting these emotions come and not stuffing them, right? There's a lot of credence to the fact that a lot of dis-ease is caused from these emotions that we suppress and don't allow ourselves to integrate with. So now is the time to do some of that self-evaluation and really reflect. And maybe if you've never kept a journal, you start to do something, even writing down is a start. So um, I I don't. Oftentimes, I get asked to talk on shows, and we talk about vitamins. But I would say the number one best thing you can do is get a good night's sleep, and that's something that I don't focus enough on when I'm talking. But it's so important, is it's when we recharge, and it's when we dream, and when we have these other the time to really let go.
Yeah. Do you recommend that people supplement if they have a hard time falling asleep and staying asleep?
Well, there's definitely some studies you'll see with the connection between melatonin and this virus, and they're suggesting that there's a correlation between the children under 9, because so far I haven't seen any deaths under 9. So they think that there's a connection between their high levels of melatonin, and then as we age and get older as well as sicker, we are lacking melatonin. So that's something I am asking our patients to do too. Like, people who are in our group, we're asking to support their system with melatonin.
Interesting. But normally, is that something that you don't recommend because it's a little bit like,
Only unless they're really struggling with sleep. I do have some patients who, in the cancer world, the integrative cancer world, they're using high doses. I'm talking 50 milligrams up to, 50 milligrams 4 times in a day as an preventive aid, and to keep the tumor cell from developing something called angiogenesis, to keep the vessels, and it stops them from growing new vessels. That's how they feed itself, right, from more blood flow. So there's some new studies to show that too, but that would be under our care or under another doctor's care. That's not something I just go rush off and do.
neuro
But what it does is,
neuromag during the day or
they
neuromag
will
or
take
magnesium?
neuromag, they could take in the day. Yeah, so the mega dose of melatonin, that would be for if you were one of our patients or someone who also specializes in that. But we use magnesium to the limit. The body's so beautiful, it will get rid of whatever their upper limit of whatever it doesn't need. So it's really hard to overdose on magnesium without you running to the bathroom with loose bowels. So you'll figure out your dose rapidly.
Sure will.
Yeah. And you know, less more often is always a good rule to go by. So instead of just taking that big heaping spoonful, you might not need that much. And we use I like the sprays. I like to tell people we use magnesium spray. For people who have anxiety, we use GABA, theanine, some of these natural agents that are creams they can rub on their carotid. And I use that sometimes if I'm getting ready to do a lecture or something. It's very helpful, and it just takes it down a notch. It takes that edge off so the heart's not racing. I try those things first before the beta blockers, and then there are doctors, you know, those are used too, but that'd be like the last choice for me. I'll try all these other things first.
Me too, for sure. Well, those things, can sometimes be habit forming and difficult to get off of.
Well,
So,
the breath is so important too, right? Going back to the breath, I've learned so much about that just in the past year, and doing breath work has been amazing. I've worked with Jack Fontana. He's amazing. Just releasing and integrating some of these emotions that have not dealt with, right? I'm happy quite a lot. And so it's not often that I'm sad or upset. So I certainly have had some work to do to get that out, to say it's okay to be sad, and like it's okay to not feel like functioning. You know, like we beat ourselves up all the time, and just allowing everything to be, and not trying to judge it, and being okay with not being productive is a new one for me.
mm, whoa, Dr. Mary, that's a huge one for you.
It's huge.
I can say that just as someone who's known you for probably 6 years. That is a big, big one for you.
Well, if I don't do like 10 things in one day, I haven't done anything, you know, but
Minimum, minimum.
minimum, yeah.
And I've been the same way too. And I think that's been a turning point for my health, and continues to be like sort of the gauge of how am I doing, is not only like, am I honoring what I feel, but like, how am I feeling as a result of like what I'm doing? And I can always recognize the force, and I can always recognize um, the not listening to something that actually should always have precedence over the achievement, you know?
Yeah. The
Um,
being versus the doing. Yeah. We're so,
Feminine versus
why,
masculine.
it's so true. We're called human beings, not human doers, but we've not really taken that to heart. I'm a
Right.
doer, but I'm turning into a beer being.
I think it's just about, societally, we're encouraged to act in a more masculine way for achievement, for what's recognized as achievement. And I think that the next wave of the experience of life in our society is going to look a little bit more balanced, having recognized this time. Can still be a time of achievement, but it looks a lot different than how we were achieving or producing prior to this time. So I
Well,
hope that part sticks, because I think that that's important.
well, that's a huge part of my practice. I'd say just in this last year, the spiritual side, and focusing on that part of their health, of my health too, of just learning more about how to listen to yourself, listen to your intuition. The meditation has truly helped. I know that everyone suggests, like, honestly, in the last year, I've seen the rise of people meditating. It makes me so happy for them to have a tool to go inside, and to, you know, and to not beat yourself up for having a ton of thoughts during the whole meditation. So what? Just the fact that you sat and did it is a huge bonus and a huge win for your entire nervous system. And so
Right.
that part I've done um, a lot of work with, and noticed just the massive amounts of inflammation and the stress that has been reduced from being able to control the breath. So,
Mm,
yeah.
yeah. I always tell people when they first start meditating, it's like you've had a soft drink closed for a long period of time, and you kind of just
Yeah.
have been jumbling it, and it's been like moving around. And when you meditate for the first time, you're opening that top, and a lot of stuff is going to come up and out of the bottle that needs to come up and out. It's been gassing, and you've just been containing it. So it's been there. You haven't given it a time to breathe and activate in the way that it wants to. Let that happen without judgment, and then and then connect to like, am I able to like recognize sort of the calm nature of the vessel now, like having allowed some of that spill out. And at the same time, like more and more is added to that vessel all the time. So just being non-judgmental in that space. But I feel like we've given people like so much information, and and most importantly, I'm hoping that a lot of people will connect to your page, because on Instagram and on Facebook, you give a lot of information and you do it in a really beautiful way. And I have so much respect for you and your dad and your family who have been researching, studying, and practicing natural medicine and IV therapy for so long in an environment where you do not often get the acknowledgement that I feel you deserve. And
100%.
so I just really want people to
Thank
connect to you and your message, and to turn to you as a community leader for their needs in
thank you.
this way.
I appreciate it. Thanks.
So we'll connect again soon, Dr. Mary. We went over by like 20 minutes, but and
Oh, how long was
to be
it?
expected, 40 minutes. But when you end, try to press the three dots and save the file there too, just in case we have any problems with the other file. So we'll press
Okay.
end, and we'll both save the videos, and we'll post them on our IGTVs. Um,
Okay. Thank
I'll
you.
talk to you again soon, okay? Mwah.
Okay.
Thank you for everything.
Bye.